Hi everyone, Felix here, Advanced Clinical Practitioner with Eden Clinic. A very common question for people who think they may have some of the qualitative symptoms of testosterone deficiency is, what blood tests do I need? So I thought it might be a good idea just to do a short video about it today. Now, whilst there is heavy discussion about the more qualitative symptoms associated with low male androgen levels, such as anxiety, low mood, depersonalization, erectile dysfunction, brain fog, and reduced libido, it is important that these are looked at in conjunction with the quantitative biomarkers in the blood, so our blood levels. Now, of course, the first thing you will think is obvious is that we would need to test our testosterone levels, and you'd be correct. However, it's not actually that simple. We do need to look more in depth at this and investigate for causality to see if there are any reversible causes that we can adjust in terms of our lifestyle, diet, exercise, that may help us to naturally increase our testosterone levels and not even have to commence TRT in the first place, which is ideal. So what else should we look at then? Well, there's the FBC, which stands for full blood count, or in the States they call that CBC, or complete blood count. Here we can examine the red blood cells themselves, the white blood cells, and also the other components that make up our blood, such as platelets, hematocrit, and hemoglobin. We need to look at renal function and hepatic function, so how efficiently our kidneys and our liver work. Next, we'd need to look at thyroid function. So the thyroid gland produces, stores, and secretes thyroxine, otherwise known as T4, and triiodothyronine, also known as T3, through a negative feedback loop process involving the hypothalamus and the pituitary gland. Now, thyroid dysfunction can result when any part of this process is affected. So accurate interpretation of thyroid function tests is essential, and that looks mainly at high or low thyroid stimulating hormone, or TSH, and free thyroid hormone levels. Now, if our thyroid is under or overactive, this can actually impact on our sex hormone binding globulin, or SHBG, through an indirect liver interaction causing issues with our steroid hormone production. There are also certain conditions such as Hashimoto's which need to be ruled out. So Hashimoto's is a type of hypothyroidism, or underactive thyroid, that is autoimmune in nature, i.e. our own immune system attacks our thyroid gland, and this can ultimately impact on our testosterone levels. Finally, it's also quite useful for us as clinicians to know certain vitamin levels and minerals and how they impact our hormone panel. So I'd always recommend looking at your iron studies, folate, B12, and especially your vitamin D levels, and sometimes we might also measure zinc levels in certain circumstances as well. So just a quick cursory search of the major online medical databases will show you how much of an impact vitamin D deficiency can have on our testosterone levels. And I'll pop some links up just here. So what about the hormone panel itself? Is it just a question of knowing my total testosterone level, and if it's low, then I start TRT? Well, no, unfortunately, again, it's not actually quite that simple. We need to know the total testosterone level and the free testosterone level, along with our sex hormone binding globulin, or SHBG. We also need to look at estradiol, prolactin, and probably more importantly, what's known as our gonadotropins, which are luteinizing hormone, LH, and follicle stimulating hormone, FSH. These last two are key as they let us as clinicians know what is happening with your pituitary gland, which is essentially the powerhouse of our steroid hormone production. Now, let's say you had your comprehensive blood test and your results point to a diagnosis of testosterone deficiency. Surely that means TRT is indicated, right? Well, again, not quite. In order to make a formal diagnosis in the UK of testosterone deficiency, we need to have at least 2 low testosterone results at least 4 weeks apart, as per the British Society for Sexual Medicine guidelines, and these need to be done in the morning and fasted. So if you're wondering about how you can go about getting these tests done, there are a variety of online providers that will do blood tests for you, but very few who will give you an experienced analysis of the results in the context of clinical experience in the field of TRT medicine. And that's where Eden Clinic can help. We offer a range of blood tests, so get in touch via our website contact pages at edenclinicformen.com. To summarise, a diagnosis of testosterone deficiency is not something that is jumped to. We need to look at causality and take appropriate blood tests at least 4 weeks apart and assess the quantitative blood markers along with qualitative symptoms from you, the patient, before making a diagnosis, because starting TRT needs to be in your best interests. So if you like this video, guys, please hit like and subscribe, and we'll see you in the next one.